To fully assess the sacrum, I'm going to be looking at movement, rotation, and counter-rotation about three axes. The left oblique axis, the right oblique axis, and also what's known as the transverse axis. The oblique axes are named according to which the superior pole of the SI joint that they cross through. So in essence, the line that's drawn through here obliquely through the left superior aspect of the left SI joint is the left oblique axis. Rotation, you can utilize your hands for this. With a hand as being a model, I have, in essence, my fingers represent the sacral base. The base of my hand is the sacral apex. If I open up my fingers wide, I can look and say the line drawn between my pinky and my thumb is being the left oblique axis. As in any axis, things are either going to rotate or counter-rotate around this axis. To that end, rotation, this is rotation around the left oblique axis. In rotation around the left oblique axis, the right side of the sacral base moves or drops anterior and inferior. Counter-rotation around the left oblique axis, the right sacral base will move posterior and superior. The transverse axis, you could say that the axis runs through my knuckles. In this case, I'm going to assess rotation around this axis by contacting the sacral base, where the whole sacral base goes or drops anterior and inferior. This movement across the transverse joint, this transverse axis, is also known as nutation. So rotation around the transverse axis or nutation are synonymous. Counter-rotation is when the sacral base, the reference point, moves posterior and superior. Counter-rotation is also known as counter-nutation around the transverse axis. The right oblique axis is defined by an oblique line that runs through the superior aspect of the right SI joint. To that end, you can use your right hand this time. Once again, my fingers represent the sacral base, the base of my hand the sacrum. If I open up my pinky and my thumb, in essence, it forms a line or an axis. Things rotate around this axis, or rotation around this oblique axis. The left side of the sacral base will drop anterior and inferior. Counter-rotation around this right oblique axis, the left sacral base will rise posterior and superior. So to that end, when I assess these movements, there's 6 basic points. 3 on the base, 3 on the apex. The 3 on the base are going to be those just medial to the PSIS on the sacral base, both the left side as well as the right side, and also one in the midline of the sacral base, bisecting the PSIS. The sacral apex contacts we're going to look for. I'm going to palpate inferiorly along the sacral midline to find the sacral hiatus. So that's going to be one of our contacts. Then just lateral to this on both the right and left side will be the other 2 contacts we're going to have. Let's look at the sacral base contacts. Using my inferior hand, I'm going to take tissue pull from S to I such that I slide just medial to the sacral, the PSIS, in this case on the left side. With this, I'm going to reinforce my thumb and I'm going to spring P to A. And what right now as I'm assessing is rotation around the right oblique axis. What I'm feeling for is resilience or lack of resilience in this movement. To assess rotation around the transverse axis, I'm now going to switch and take a midline contact on the sacral base. Once again, taking tissue pull with my inferior hand from S to I, and now I'm going to spring P to A on the sacral base. To assess rotation around the left oblique axis, I'm now going to take a contact, once again with my inferior hand. I'm going to take tissue pull from I to S to a point on the sacral base just medial to the right PSIS. And once again, I'm going to spring P to A. Of the 3 contacts so far, he had a little bit of resistance when springing on the left sacral base, which in essence would be rotation around the right oblique axis. When contacting the sacral apex contacts, to this end, I'm going to contact just left of the sacral hiatus. I'm going to take this time my superior hand, taking tissue pull from S to I. I'm going to reinforce this with my other hand, and I'm going to spring through this contact. Right now I'm assessing counter rotation around the left oblique axis. To assess counter rotation or counter nutation around the transverse axis, I'm going to contact the midline of the sacral hiatus and spring P to A. Now to assess counter rotation around the right oblique axis, I'm going to contact the right side of the sacral apex, just lateral to the sacral hiatus, springing P to A. Of all the movements that I felt here, I felt there to be a little bit of a restriction on my contact on the left sacral base, so that's going to be a rotation around the right oblique axis. And there also was a little bit of a restriction when contacting the left side of the sacral hiatus. In this case, that's also going to be as counter rotation around the left oblique axis.